So we had the Costo Clavicular Thoracic Outlet Syndrome. So first we're going to start with the orthopedic tests. So the first one, kind of the gold standard, is the Adson's test. So first you want to locate the patient's radial pulse. From there, what you're going to want to do is you're going to extend the arm, you're going to externally rotate, you're going to have the patient take a deep breath, go ahead and tuck your chin to this shoulder, and basically what I'm doing is I'm feeling to see if that radial pulse disappears. So you're basically closing down that costoclavicular space, and you're wanting to see if it's entrapped, and that radial pulse will disappear. That'll be a positive sign if the radial pulse disappears. The second test is going to be a costoclavicular orthopedic test. So that one, again, you're finding that radial pulse. From there, what I'm going to do is I'm going to pull the patient's shoulder down, and from there, he's going to go ahead and stretch his head away. And on this one, again, we're taking that costoclavicular space, and it's a positive test if that radial pulse disappears. So next is the neurological test with the costoclavicular thoracic outlet syndrome. So the most affected nerve roots is going to be C8T1. So what we're going to start by doing is testing the dermatome of C8, which is the medial forearm, and we're going to test it against the lateral forearm so we can to make sure that it's a positive finding. So first, and then of course all these tests are going to be done bilateral. So did you feel that? Okay. Did you feel that as well?
Mm-hmm.
Were they the same?
Yeah.
Okay. How about that?
Mm-hmm.
And that?
Mm-hmm.
Okay. Were they the same?
Yeah.
So a positive finding, again, would be if there was diminished sensory of the dermatome of C8 of the medial forearm compared to the lateral forearm. And again, this often happens bilateral, so you want to make sure you check both. So that's sensory. So next we want to go to motor, and again, it's C8T1. So we're going to start with finger flexion. So I'm going to pull your fingers and resist. Good. Next one. Good. Okay, so next you can place your hands out. Okay, so we're going to adduct, so resist. Good. Resist. Good. And then the last one would be abduction of the fingers, which again is T1. So resist. I'm going to push up. Good. And resist. Push up. Good. So we tested the sensory and motor of C8T1, again, the most common nerves affected in the syndrome. So last, we have the radiographic findings with costoclavicular thoracic outlet syndrome. The most common cause is going to be bilateral cervical ribs. So as you can see, we have bilateral cervical ribs. And really you can tell when you're looking at the first rib with the clavicle, how that space is really impinged. And again, that's the most common cause of the costoclavicular thoracic outlet syndrome.